Did you know that one person dies by suicide every 40 seconds? And all these deaths are preventable. Yet survivors and families, they feel so ashamed about what has happened, and nobody is talking about all this. When we compare this to a medical scenario, it's so different. Let's say someone dies by cancer or renal failure. You count the death as a symptom, as an outcome, as a fatality. Somehow, when we talk about death by suicide, it is understood as if they wanted to do this, that it's a choice, that they chose suffering. But no one wants to choose suffering, no one wants to be miserable. We need to change how we speak about suicide, how we talk about suicide. Suicide is a symptom. It is a symptom of depression. It is a symptom of untreated chronic illness. It is anything but a choice. In case you notice someone in the family or your colleague or a friend who has become a bit withdrawn, has become very quiet, doesn't seem as enthusiastic as they were before, maybe it's time that you check in and see how they are doing. Often people who are depressed or people who have thoughts of suicide, they don't really open up to anyone. So it's our job as a loved one, as a colleague, as a friend and a well-wisher that you check in and make sure that they are doing okay. If they are in fact suicidal, it's important that you let them know that there is help available, there are hotlines, there are professionals, there are counselors in schools and colleges. Help is always at hand, and that is something that everyone needs to remember.